Okay, this is part 2 of our interview. Let us start from where we stopped. We were doing another scenario, which is 42 years old, high risk pregnancy, which combined test was high risk combined test, and which is high risk for Down syndrome. And you needed to counsel her. 42 years old, right?
Yeah, it is 42 years old woman came with her anti-test, and it shows combined test showed that having high risk for Down syndrome. So I just asked her a little history that how many babies she's having, and any history of
Sorry,
small baby.
Sabia, sorry to interrupt you. So there was a result of the combined test in front of you?
Actually, yes, it was on the.
It
I
was
forget
written
now, but yes, there was
1:2.
there was the result. It mentioned the result.
Okay.
It's showing the it's a conclusion what I read, that it is high risk for the Down syndrome.
So it was not written in the ratio, but it was written in the text form.
Hello.
Yeah. So the result was in the text or in the ratio?
Actually, Samira, I forget now. But
Yeah, it's
I
okay.
what I remember then it was a result.
Okay.
Okay. But I just
Fine.
I took just a small history, whether she's having any no, how many kids she arts obstetric, how many kids she's having, or any issue of Down syndrome in her family, in her siblings. So actually, I just want to know how much her risk other than this,
Yeah.
other than her age, what is her risk?
Yeah.
Then after that, I ask her, what do you know about the Down syndrome babies? So I explain her what are usually Down syndrome babies, and then after that,
She was 12 weeks or 11 weeks or something?
yes, usually combined test is done in
At
10,
11
10,
plus. Yeah.
10 plus weeks. Yes.
Because after the NT scan, maybe 12
Yes.
weeks. Yeah.
Yeah. Also, she was asking, what does it mean? What does test mean? So I told her screening, and then I explained what is the screening and what this test does mean. Then she said, what my options, what I should do now. So I told her about the invasive testing, the confirmatory test, and then if we have confirmatory test and it found that the baby is down, so I already explained what is Down syndrome babies. It is not life threatening. Down syndrome is a not life threatening condition, sir. It's compatible with life, and some of them they are having yani very good life. So I told her about the little descriptive
About
Down
the
syndrome
physical
babies.
and mental
My physical and mental, what
characteristics, actually.
I read this about Down syndrome, what I memorized that I just explain its few features. Then I give her the option that I fix a meeting with the pediatrician also. They will explain more about how the Down syndrome baby looks like and how we manage, how the outcomes. So you will get answer of the question, many of your questions. Then she said, what my options? I said, there are invasive procedures which we do to confirm, like amniocentesis, choreocentesis, CVS, and I told what gestational age and what are the benefits. No,
Yeah,
we can.
and 1 or 2%, like
So I asked her
miscarriage rate.
if we do and it is confirmed whether she's going. I asked her whether you are going to go ahead with termination. Then she said, no, I am not going to terminate this pregnancy. Then she said, if I don't go for this testing, I said, it's up to your total your wish. We will respect your wish, whatever you decide.
Yeah.
And if you go and it is confirmed, it's down, and you still don't
Want to
want to go
continue
for
the
termination,
pregnancy? Yeah.
want to continue the pregnancy, it's up to you. We will respect and will support you in your decision. And then she said, if there is any other test, I heard that the blood test. Then I understand she's talking about NIPT. I say, yes, you can go. It's more sensitive, but still it's a screening test.
Yeah, 99.9%
Yes,
sensitive.
it gives you more. Yeah, it gives you more chance. It's near 100%, But still, it's not 100%. It's
But
still a
still, it is
screening.
not diagnostic. Yes.
Not diagnosed. It is a screening. Right? That's it.
Mm.
Then she said, then I have to decide now. I said, no, I'm giving you written material
Mm.
about individual testing, about Down syndrome babies, and I'm
Mm.
giving
Fix an
you,
appointment
I
with the
am fixing your appointment with the
yeah,
pediatrician. It will give you more
insight of the problem. Mhm.
outcomes or more insight of the problem and how you will manage.
Yeah.
If you confirm, and I just told her that if you confirm by doing invasive testing, at least you prepared
Yes, yes.
manage your
It is
baby.
not only the
If
thing
you
that
don't
if
go
she
for
want to
family.
terminate the pregnancy or not, but if she will
Yes,
know, she can prepare herself mentally, and the
yeah,
pediatrician can prepare themselves also. Maybe she
prepare
will
her.
need a surgery. The baby might need a surgery, cardiac surgery or
Yeah.
something after
Yeah,
birth.
I talked about the anomaly also. We will
Mm.
check the anomaly. If there are major anomalies or in the babies, like Down syndrome babies have heart defects, so we can
Mm.
pick on the ultrasound or we can go ahead with the echo. If it is
Mhm.
confirmed it's the Down syndrome baby, then we will be vigilant in doing
Mm.
ultrasound and we might offer the echocardiogram at 22
Yes,
weeks to see the
it
heart
will
of the
help
baby.
us to
Like
plan the pregnancy
plan
and delivery and
pregnancy
after
and
delivery.
the delivery and after delivery. So I just talk
Okay.
about this all because the
Okay,
patient
that
say
is
I am
good.
not going for termination. So this is and
Still,
it was around
you still needed to
20
explain all of
dollars.
these things.
Exactly. Yeah.
Mhm.
I
So,
just did this one.
and then the seventh scenario was about, I think you told me bladder pain syndrome, but what was the exact
Yeah,
scenario?
it was bladder pain syndrome. She was very nice and she gave me the typical point of the bladder pain that when she
Hmm.
passed urine, her pain relieves.
Hmm.
And
Okay.
she said, I forget, but it was bladder pain syndrome. So I just talk about the management of the bladder pain syndrome from the lifestyle modification. Then
Mm.
the simple analgesia, I just talk about the initial management and the specialist management. I ask,
Mhm.
so first we will start from this lifestyle management, then some amitriptyline or something like, some
Hmm.
simple thing from the start. So I just give her, yani like bold management options.
Yeah, like, from the guideline, right?
Yeah, from the guideline.
Okay. So this is the guideline. So she was only having
Yeah,
that bladder pain syndrome and there was nothing
and she
else.
was satisfied actually. Exam the role player. When I
Mhm.
talked about according to the guideline, there are charts. I just elaborate those charts, and she was satisfied with the with the things.
You mentioned the guideline?
No, I I meant some in some stations I mentioned the guideline that usually we treat such situation or such conditions with that guideline as given in our. But I think I did not mention
Here
here.
in
I don't know. I
here
don't.
maybe
I
you did
forgot.
because of the role player.
I don't think
With role player, I think you don't need to, but for the
but with the
Viva with
examiner, I
examiner,
usually
you can.
mention the
Yes, you
guideline.
can, of course. Okay, so the eighth scenario was about labor. What you said there were 8 cases. So
Yeah,
just give
what I
me
remember,
the
there
outline.
was one patient
You
with
were
the trial
able
of
to
scar. There was one
you
shoulder dystocia.
one was
I
shoulder
did six
dystocia.
stations. I finished six stages.
Only so you didn't finish 8.
I know I did not, but the most important stations I finished.
Okay, okay.
There was eclampsia, there was shoulder dystocia,
Mm-hmm.
there was one PPH.
Mm-hmm.
So these all stations I finished. So for that reason, I think I passed this stage.
Yeah. So
Post
it means
emergency
that
situations I managed
even if you are not able to finish 8 cases and if you finish 6 cases, you can still pass the station, right?
because because the examiner assess you in these six stations how you are doing, how you are managing. It
Hmm.
doesn't need that you will finish all the stations. It's your attitude, how you are managing, how you are doing.
Mm-hmm.
That's I got the point during practice also and during the exam also.
Hmm. So you prioritize them. So the most important you discuss, the
Yeah,
most urgent.
but she said from the start, she said go room by room.
Oh, she
Don't
told you.
when I said I will prioritize, I will take I will pick the most emergent case. He said, no, go one by one.
Oh, so imagine that the
He
most important
the
and the
examiner,
most
yeah,
urgent case is at
the-
the end, then you will not
yeah.
be able to finish it.
No, actually, because in 2 minutes, I already read that all scenarios. So it was in my mind that I have to do this, I have to reach this station. So I didn't give too much time in one station. I elaborate important points and I go to the next
So
one.
you mean
I
luckily
elaborate
the
important
last two
points.
stations was not the most urgent one.
Not that much urgent, yes.
Okay, then it's fine. Okay. So you go according to the examiner because she directed you to
Yeah,
go
she said go room by room,
room
one
by
by
room.
one.
Okay. And then so this is the prioritization. So how you like uh, you delegate your staff, then you delegated your staff to each room.
Samira, now it's almost more than 6 months. I forget what I did.
Mm-hmm.
But usually the most important urgent things, you are the one, you are doing it, and you are calling you are informing your consultant also, and you are calling if you are opening two theater, you are calling your consultant also,
Mm-hmm. So
and you are
so a
seeing,
short management including the history
yeah,
and some investigations and examination if it is needed,
yeah,
and a short management of each of the case, the initial
yes, and
management.
some, yes, like we practice, like if it is simple case or simple episiotomy, and if it is cord prolapse, but
Mhm.
the CTG is okay, then what kind of cesarean, and if it is CTG is abnormal, then what kind of cesarean.
Hmm.
So,
Okay.
and how do you manage?
Yeah. Then you talked about gynae list, and you said that it was not
Gynae
that great.
gynae list for me, I was not happy with my gynae list. It was some very difficult scenarios. I think somebody have recalled, so they have.
Yeah.
Right now, I cannot talk about that gynae list because I forget even,
I will
and
bring
even
that
that
gynae
is
list and
difficult for me.
I will look at it. What are the
Just try
cases?
to look at gynae list, Samira, if you found it,
Hmm.
and try to solve this for the candidates.
Yes, I will do that
It's difficult,
station.
actually. Yeah.
Mhm. I will. So the 10th station was like structured discussion. You said acute renal failure post hysterectomy, and she was having anuria. She was in the ward.
Yes, it was,
In
she
the
was in the ward. She
Okay,
was in the HDU,
I see. HDU.
and
Okay.
urea,
Mm,
and but at the time, what the investigations wise, her
mm.
labs were almost normal. Only I think creatinine is little
Creatinine was
on
high.
the higher side, a little high,
Mm.
and she was, I think, dehydrated as well.
Mm-hmm.
So then they are asking the risk factor and what will be the cause. She was on NSAID, I think.
So
She
you
was on
should know
NSAID.
the causes of acute renal failure
Actually, there is a
post-surgery.
talk article with acute renal
Yes.
failure.
Mm-hmm.
And this acute renal, they are very much interesting in this renal problem. So I would advise all the candidates for part 3,
Mm-hmm.
just do acute renal failure, chronic renal failure, or renal transplant on their
Mm.
fingertips. The examiner, they are very much
And
interested
even the
to ask
11th
about
scenario, the structured discussion was about post-renal transplant, who is 36
this
weeks
is the,
pregnant.
yeah, this is the famous recall.
Hmm.
36 weeks pregnant, post renal transplant is on the list for elective cesarean section.
Hmm.
And they are
Hmm.
giving that her renal functions are completely normal. There is no
Hmm.
rejection. She is doing fine. Baby is normally growth. No
Hmm.
IUGR, no diabetes, no hypertension.
Okay.
Proteinuria is proteinuria. So for that, if everything is fine, why elective cesarean section? And
Hmm.
the examiner question, the most important what precaution, if you plan for cesarean, what precautions you will take for this kind of patient during pre-op, during surgery?
Yes.
These are her the examiner pet questions actually. I
Yeah,
tried to
because
answer,
of the renal
but
transplant, she will be having like adhesions or something. So the cesarean section will be um, not
yeah, you
an
have to
easy one.
care, you have to take care during cesarean section, and according to the talk article, you have to call the
Consultant
transplant team,
and the
transplant
transplant team,
team
yes.
during surgery. They are the one they know where the blood supply coming
Because
to the
the
transplant.
transplanted kidney will be there.
Yes. So you
Mm,
have to talk to them, you have to involve them,
mm.
and sometimes they are the one they will advise you or they will come to help you for this doing the surgery
Yes,
to avoid injury to the transplanted kidney.
yes. So do you
Or
remember the
somehow you have to do ultrasound also and you see incision. I forget some of the talk article. It's
uh-huh.
a very good talk article
Mm,
about transplantation, pregnancy after transplanted kidney, and
mm.
how we do surgery and how we go ahead. This all mentioned there.
It is
And the
all
examiner
mentioned there.
was
You
asking
just
all
need
the
to
things
read.
there.
So it's
Yeah.
your
And
knowledge
examiner was
also.
asking all the things
As some
related to that.
people are saying that you pass your part two, so you don't need to study. So that's not true.
No, 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 no.
Hmm.
See, in all the stations, they are judging their knowledge also.
Mm-hmm,
It's not
definitely.
only the communication, knowledge as well.
Do you remember the 12, 13, and 14 scenario? Three more scenarios remaining.
Hmm. Just a minute,
Sorry.
let me check, let me,
Mm-hmm. If you can remember, otherwise it's okay.
I don't remember actually.
Mm-hmm. It's
No,
okay
I think
because we just like we discussed 11 scenarios, and I think um, you gave us very, very important points. Especially, I like this one. The gyne list, by the way, I'll bring that gyne list. We will discuss it. We'll make like a station, and we'll bring the candidates and we'll discuss it.
yeah.
Uh, and then you said about the labor ward prioritization station that there were 8 cases, but you did only 6 cases, but still you were able to pass the station, which is very good. And the rest of the stations were mostly like recalls, and there are guidelines and talk articles about it. So you just need to revise, because nowadays the the OSCE is not immediately after theory, so you have gap, so people tend to forget, so they need to revise their knowledge.
Repetition actually. You know, Samira, the course is exhausted. The list is exhausted. So, and how do you remember?
Hmm.
So,
At least the
repetition. What
important
I found,
recalls. Hmm.
repetition is the key to pass this exam. Repetition. Repeat,
You
repeat,
mean
repeat.
discuss with your study partner or with the mentors? This is what you mean,
Yeah,
repetition.
with the study partner, repeat stations,
Hmm.
repeat station, repeat, so that you talk easily with that sub. Yeah, one station I remember now. There was one
Hmm.
station, one role player. She came and she said one of my friend died with the ovarian cancer. She
Hmm.
diagnosed third stage ovarian cancer at the third stage,
Hmm.
and then she died. Okay,
Hmm.
so I apologize. I just say sorry to hear your loss.
Yeah.
And
You empathize with her, empathy,
then
showed
I
the
took
empathy.
her. Then she came. You know why she came? She said, "Remove my both ovaries," and she was 35 years of age,
Okay.
33 or 35. Then this was a very nice station actually, and it was totally recall station.
Hmm.
You have to talk about, you have to take her history, you have to counsel her, you have to reassure her. She is very low risk, like general population risk. So I told her,
Hmm.
you are just like other women, you are not at high risk because
Hmm.
you don't have any family history of ovarian
Hmm.
cancer, and in your personal history, there is none. And but
Hmm.
what I forget to ask. Then because she came to know the BRCA1, so I give a little elaboration of the BRCA1, what is
Hmm.
BRCA1 and BRCA2,
Hmm.
and how to be diagnosed, And if it's somebody cancer positive, then how do we manage? There is one option to remove the ovaries, but in that situation, there is surgical menopause. We have to give the hormones, HRT, for the general health.
And you took
For
the
the
family history. She was
then I
low
took
risk patient.
family history. Yeah. Then the other options, the monitoring, you can monitor her, yearly ultrasound, mammography. This is another option, K1 to 5 and yes. And then there is one thing, she can use the oral contraceptive pills also. It's and she was already on oral. I did not ask her contraception. I forget. Then she's the one. She's the one. When I reassure her, and she was previously cesarean also. And I told her, even if we go for bilateral salpingo-oophorectomy, it might be difficult for her. She is a cesarean section. So I talk all this, and I give her reassurance, and then I ask, and still, if you want to go ahead, we will respect her. We will respect your wish, and we will support you. And I'm giving you all the written material about BRCA and BRCA2 and your chance, and where you lie, where you stand. And I'm giving you a point with the consultant as well, so that you will read it, and then in the next meeting you will discuss, and you will what you decide, you will inform us so that we can arrange. Then she said, so doctor, what should I do? I should continue oral contraceptive pill? Then I realized, oh my God, I forget to ask this. And I say, yeah, this is preventive. This is even protective for the ovarian cancer. I just say this sentence, and the station was closed.
Okay. But anyway, they know that you knew it, we just forgot. Yeah. Which is fine, yeah. So okay, it's very nice. I'll do one one more like this, um, maybe a scenario discussion, 2 scenarios discussion, and we'll do it with the students, with the candidates, especially the gynae list. I really want to do it. I want to see what is the problem in it. So let me get the cases, then we'll discuss. Thank you very much for your time, Sabiha. It's a pleasure. You always, whenever I ask you, you always take your time. Of course, you are working and you are busy. It's late at your place, and then you must be very sleepy. So I will close here.
You're always welcome, Samira. Whenever you will start the your candidates teaching and all, I would love to join you.
Yeah,
because I'm
you will be with us
now. For sure, inshallah, I will be with you.
Yes.
And we will discuss, and I will guide the candidates how to go ahead and what was my experience.
You know what I'm thinking? I'm going to give them all the written, what you call it, the model answer, so that they have written model answer of each of the stations. I think that will be great. Of all the, as much as possible recalls we will do.
Yeah, sure, inshallah. Yes, we should give them the model answer so that they stuck on it, and they revise, repeat and repeat.
And then they do it with their study partner. They revise it like many times. Yes.
Yeah.
That will be
when
good.
They revise many times. Yeah. When they revise many times, then while talking to the patient or
it will come automatically.
Automatically in their mind. This is the key to success in this exam, actually.
That's true. I agree. Totally agree. Thank you very much. Thank you for your time. I'm going to stop here.
Yeah, one more session I realized now. There was one woman sitting in the maternity ward, and I have to take her consent for the postmortem of the stillborn baby.
Oh, another recall.
Yeah, another recall. And that was a very important recall. The patient has just delivered a stillborn baby. How many hours before? Maybe 12 hours before she just delivered, or maybe 24 hours before she delivered a stillborn baby.
She delivered at term?
She was white, she was sad, she was not crying, but she just quiet.
Quiet, okay.
And they give me the examiner, they say I have to explain postmortem,
Hmm.
why we are doing, and I have to ask, I have to sign the postmortem form,
Consent
and
form.
I have to answer her concern.
Yeah, answer the concern. This was the station. I think
So
this is
this,
also
so I just like the template of the exam that I'm so sorry
hmm,
and something pathetic happened to you,
hmm.
and I just imagine, even I cannot I don't know, I just remember some, that time I just remember some sentences how to talk to such patients, because you cannot, I can understand, you cannot understand actually
Yeah,
what the
I
baby,
think this
the
is not
mother
a very
having an
good idea to say that I
yeah.
understand how you are
I
going
just,
through.
yeah,
So
so
you don't understand actually.
I just have an idea
You can say
how a
that
terrible thing
I
happens to
can
me.
see that you are very sad, and it's an
Yes,
obvious reason.
yes.
You took the history, a little bit of history.
Yeah, I took
Mm.
the history.
So
I
you
asked her
asked her that if you
that,
don't mind, can you tell me
yeah,
a
if
few
you
things
don't
so that
mind.
I can explain to you more in a better way? Yeah.
And I'm so sorry, I am seeing in such situation.
Okay. Yes. So what was the
And
reason of her
then,
IUFD?
no,
It was
unexplained. It was
unexplained.
unexplained.
Yes. Then you follow the pattern of
Then I found
unexplained,
the
I think.
template that why the postmortem,
Hmm.
complete postmortem. Even if we do complete postmortem, in 50% of the cases, we don't even find the cause of the death.
So the results of the investigations were there,
No. Actually, all the investigation,
were
X-ray.
sent.
Now we are just suggesting now.
Yeah. Oh,
Just
so
24 hours. Just 24 hours she delivered a stillbirth. And it
hmm,
was unexplained. There is nothing wrong. I think it was IUFD before. I forget Samira, but I have to take the consent. I have to explain the postmortem examination, what is
hmm,
complete, what is partial,
hmm,
and I have to ask if she has a right to decide either partial and what is external examination, X-ray, ultrasound, then
hmm,
partial examination, some of the structures, and then complete examination like all the structures and the
hmm,
brain and heart. So I have
hmm.
to explain how it is done. We have to
Okay.
give a cut anteriorly, then
Yes.
on the back
Three cuts
of the head.
basically.
I
Hmm.
have to explain. Then I have to explain then who is the one doing it,
Yes.
and without her consent it cannot be done. And the baby will be, after examination we
How
have to take
baby
some of
will
the
look like.
tissues. Yeah, then we examine, and then the baby, we will close those incisions like a surgery. So
Yes.
I just, there was some, I read that scenario from, I think, Wafa or somewhere. This
Hmm.
scenario is given somewhere, so I read it from there, I think.
Yeah, we will deal with the baby with dignity, and you offer her if
Dignity,
you want to keep the
and we
foot
do, it's
impression
like
or
a
the hair
surgery,
lock, and
it's
you
like a
offer her
surgery.
assistance in funeral also, and you will let her bring
Yes,
a
yes,
nurse and all these things, you know.
yeah, the hospital will do it for you.
Hmm.
And she said, if I say yes, and later on I change my mind, then what you will do? So I
Mm-hmm.
told, yes, we will respect your wishes.
Yes.
We will do, if you, even if sometimes you change your mind, you can call us and you can refuse, don't go. If it is not done, we can stop that with your
Yeah.
consent.
Yes.
It's not that you consent now and you cannot take your consent back. Even
Yes.
though that answer was, I didn't know with this certainly, but I say yes. If you, after some time you change your mind, you can
Yes,
ask us,
you know, a
don't do it.
patient can take back her consent anytime. So yes, this is general principle for every consent.
That, for that reason I say yes, because
Hmm.
I know that consent can be withdrawn at any time.
Yes. Okay. So that's great. Thank you very much. So you remember all of the scenarios, and that is great. We discussed about all the February 2022. And thank you very much. Thanks a lot.
You're welcome, Samira. Thank you.